Hello, my name is Shayna and I'm doing my second video presentation for Pathophysiology. This video presentation is on a syndrome, and the syndrome that I have selected is acidosis. Acidosis occurs when you have a buildup of acid in your system, and we consider things acidic when they fall below a 7.35 on the pH scale. Usually, acidosis has a sort of primary or initiating event, and then that is followed by a adaptive state of the body, or a way for the body to compensate for that change, in an effort to return to homeostasis. So the combination of that initial event and the homeostatic, basically, mechanism is what usually contributes to acidosis. We diagnose or measure acidosis by looking at the anion gap, which is basically an electrolyte panel. So we're measuring different electrolytes and different ions in the body, to determine where there are gaps. There are two main groups of acidosis. We have the metabolic disorders and the respiratory disorders. The metabolic disorders alter the bicarbonate concentrations in your body. They're usually the result of an extracellular fluid change. Clinical manifestations of metabolic disorders include a decrease in the pH level. You're going to have signs and symptoms specific to whatever the underlying cause is, but you'll often also, have cardiovascular effects, neurological effects, and musculoskeletal effects. Respiratory disorders, these are altering the partial pressure of CO2 in your body. So you're increasing the pressure of the CO2, and usually this is accompanied by decreased ventilation and, of course, a decrease in pH, leading to the acidic level. The clinical manifestations of respiratory disorders, again, also relate to the underlying condition, but anytime you have an increase in CO2 and a decrease in oxygen, you can see vasodilation or headache, blurred vision, and other psychological sort of abnormalities or disturbances. So there's a lot of different syndromes in the body, a lot that can affect the body, and a lot even just relating to fluid and acids and bases. So I just wanted to talk about a couple others that might seem to be confused with acidosis, but that we can differentiate between. The first one is alkalosis. This is literally the exact opposite of acidosis. Alkalosis is a buildup or an excess of base in the system. We consider something basic on the pH scale when it is above a 7.45 on the scale. Again, we would diagnose this by looking at the anion gap. Another syndrome that kind of in the same realm as acidosis but different is hyperkalemia. This is when we have an increase in potassium levels in the plasma, and we would diagnose this by taking a history, doing a physical exam, looking for muscle weakness, possibly ordering an ECG. And hyperkalemia is most commonly caused by a decrease in renal elimination. It can also, though, have serious effects on your heart. The third syndrome I just want to touch on is hypernatremia. So again, hyper, we're going to have a high level of something. We're in this case having a high sodium level. Or another way to look at it is a deficit of water in relation to the sodium level, pretty much always accompanied by cellular dehydration. To diagnose, we're going to order lab tests, we're going to do a thorough history, and of course take a physical exam. I want to talk quickly about three diseases that fall within the acidosis realm. The first one is lactic acidosis. This is usually the result of inadequate oxygen delivery, but lactic acidosis is the most common type of metabolic acidosis, and it can be the result of a buildup of lactic acid or possibly the failure to properly eliminate lactic acid. Second disease I want to talk about is diabetic ketoacidosis. Basically, this occurs when you have your body breaking down fat at too fast a rate, and you are producing high levels of ketones, which are actually fuel, but when they build up too much in the body, it can lead to your blood being too acidic. This can be accompanied by a decrease in alertness, deep rapid breathing, fruity breath, excessive thirst, among other symptoms and signs. The third disease I want to touch on is chronic kidney disease. Your kidneys are normally secreting hydrogen ions. They secrete them into the urine to be eliminated by the body. When you have, chronic kidney disease, you're going to have decreased kidney function. They're not going to be able to keep up with the levels of ions that need to be, the levels of hydrogen ions that need to be eliminated. So those build up in the body and can lead to acidosis or increased acid levels. Thank you for listening to my presentation. The sources that I used for this are, of course, our Pathophysiology textbook, which I did the bulk of my research in. However, I also used the National Institute of Health website, particularly for information on diabetic ketoacidosis. Thank you.